Hello there, I'm Carl and this is my ChiroSeries 1.3 chiropractic treatment table. If you guys have any questions, just shoot us an email. We're happy to do a live consultation to show the details of the bench anyway, but let me try to walk you guys through this quickly so you have an idea what we have here and what you can expect from this product. So first of all, the naming. 1.3, what does it mean? It's a valid question. So 1, 2, and then 3. I'll put it up slightly like this. So I have the cervical, the TMJ drop that I tend to use. Sometimes the CT, upper thoracic drop piece comes to help. And then obviously the pelvic drop that most people are familiar with. Personally, in my practice, I don't use drops that often, but in some cases and sometimes when the joint manipulation or mobilization doesn't give us the results we want, I'm happy with the knowledge that I have the drops to use as well as a backup tool. Some people use them a lot. That's up to you, it's personal preference. These drops have gone through a lot of testing, they are bulletproof. What I would like to add is that we also have availability for the thoracic drop to open this way. So you can have cervical, upper thoracic, lower thoracic and pelvic. In that case, the table would be 1.4, so ChiroSeries 1.4. So the numbering is all about how many drop pieces you have. If you're somebody who only wants a cervical drop piece, that's absolutely fine. We can make you a table like that. Or if you're somebody who wants only the pelvic drop to help with your lumbar or pelvic adjustments, that's absolutely fine as well. The drop pieces are adjustable from these knobs. These knobs are available on both sides of the bench, exception being the cervical drop. You have the knob only on this side because over here we have the support for the roller. So you have the paper roller coming across all the face pads, and here on the other side you also have the facial paper cut off. Good. So drop pieces out of the way. Few details. The pelvic pad we've made firmer. Here's 10 kilo or 22 pounds of weight, and you can see when I lean in here that the weight is not sinking in that much. If we go over here, if I lean onto this one, you can see it's going much deeper. That's the reason. Or the reason being is that for patient comfort, we thought that having softer and more forgiving pad around the chest is better, because the thoracic adjustments are in general a bit easier to do anyway. But with the pelvic and lumbar spine, we decided to go for a firmer pad so that the forces that you put into the adjustments are not dissipated to the pads. So you really get your mobilization or your manipulation techniques through the patients the way you intended to. Another patient comfort aspect are these hand supports. If you have a wider patient, a larger patient, and you turn them supine, sometimes you see on a narrow bench they have to, like, their hands are going to drop, or they have to put them behind here or on their belly like this. In that case, their upper arms are supported and hands can be in an anatomical position easily like this when they are laying supine. When you turn them around into prone positioning, you can just either with your hand or with your leg just drop it off like that. That's it. The same on the other side. Maybe you just come through with your hand and it drops off. Then you use the levers to lower the face down and the patient goes into prone position. From here on, in the past, I've had to use these things, and I'm sorry to say, but like over the years I really started to hate it. It's like it was always that 3 or 4 or whatever seconds that you had to like, you know, mess about. Hey, can you please lift your feet for a second? Boom. I really like to use it because in my experience, patients' hamstrings and the lower back seem to be slightly easier, slightly more relaxed when the feet were supported. But now there's a hydraulic lever here, so that's it. 1 second and it's done. You don't have to tell them to raise the feet, whatever, it's done. You can regulate this, it can go slightly higher, it can go just a few degrees, and that's it. If the patient is a bit taller, you can unscrew those. You have your basketball, your volleyball players, you can keep that all the way open. I don't use that too often, I just keep it somewhere in the middle, and it works for most of my patients, except when you get this, you know, old one out who's like 210, and then you have to play around. So that's patient comfort. Oh, maybe just to add, but I guess they're self-explanatory. The forearm supports are slightly tilted down so that the shoulders are nicely, or the shoulder blades are slightly dropping off, and patient feels relaxed. And what you can do with them, you can obviously raise them slightly if you need to. I keep them fairly loose, so I can rotate them in or out depending if I want to see something happening here with the scapula or the shoulder or shoulder girdle positioning. But now let's think about the practitioner. So how is this bench useful to me as a practitioner? One main thing is the 360 pedal for height adjusting. So when I press down here, it goes down. I put my toe underneath there and boom, it raises up. Let's say I'm checking the ankle here. I have the T-bar, so I can adjust it here as well. And these are actually extendable, so depending on your foot height, your or your foot length, or your personal preferences, you can either have it in or out. That's up to you. You can just fixate it quickly and that's it. I'm on this side. I can again raise it if I need to. I can lower it, no problems. And the main thing, let's assume I'm working with the cervical spine. Maybe I'm looking into doing a TMJ with the drop piece. Maybe I want to have this slightly up as well, but now I feel I need it slightly higher. Okay, I just go here, I press it, I get it slightly higher, and then patient is well positioned. Boom, I drop it, that's it. So that's one of the things. Another thing is that it goes quite low, 55 centimeters. So if I'm a smaller practitioner, I can still really lean over and have my adjusting done the way I need to. On the other end of the spectrum, we can get it almost to 1 meter of height, so 97 centimeters. I found it very good for physical examination. So whether I want to stay longer at the cervical spine or the shoulders, looking at the ankle or the knee joint here or the hip, having the availability to have the bench quite high up. Let me show you how high it goes. That's the highest it goes. See, it's on my belt level roughly. Over here I don't really use it, but somewhere slightly on the lower end here I see myself using it, and I've used it quite often. It just makes the physical examination so much easier. Also with exercises as well, like sometimes, let's say I just want to show patients like reverse hyper. I can just kind of lay on top of here and then swing my legs up, and quickly I've shown them reverse hyper. That's it, on my own chiropractic table, rather than having an extra bench or a tool or a set for those exercises. Good. So this is our bench in a nutshell. I already steered slightly off topic. if you guys have any questions, drop us an email. Once again, we're happy to even make a video call, and maybe you have some direct live questions so I can show you how it works. I think I forgot to show you the headpiece. Wide setting, you can see my whole forearm goes in here, and I can also close it down as narrow that I can only fit my fingers in here. Again, I don't use it too often, but I know that the adjustability is there. I keep it in the middle, that's it. Rarely I need to use it. But you do want to have a bench that you know that you can adjust and tweak if you have that odd case or that very sensitive patient where you need to play around with their anatomy and their positioning. Once again, we are really proud of it. It makes my life easy. Patients are happy with it. If you have any questions, shoot. Thank you.